Hi everyone, my name is Kei Ouchi, and I'm an emergency physician and palliative care researcher at Brigham and Women's Hospital in Boston, Massachusetts. And today, I'd like to take a moment to introduce an article I wrote about managing code status conversations for seriously ill older adults in the emergency department. Have you ever had a time when you are taking care of patients who might be nearing the end of life, deciding what kind of code status that person should be, and afterwards you weren't exactly sure whether you did the right thing? Well, I have, and that's the reason why I started to kind of look into this area more. And this happens because most older adults come to the emergency department in the last 6 months of life, and this frequency increases as they get closer to death. And I think this is actually a critical moment for many of these patients to start thinking about and also communicating to us exactly how they want to be cared for if they were heading towards end of life. Because I know as a clinician, procedures like in the intubation is already a really bad news for many older adults. The mortality is really high, and if they were lucky enough to survive, there are many complications that are associated with surviving critical illness like this. And in my head, I'm always thinking, like, do patients and families actually understand this when they are facing this decision making? Because we also hear from patients that there are many states that are worse than dying for them. So I think that us, the clinicians and the patients and families, are simply miscommunicating, and that's the reason why I wrote this article. So this article is published in Annals of Emergency Medicine, and it articulates exactly how to do this, just like any procedure that you might do in acute care settings. I've also created a video for everyone to watch so that you can kind of see exactly how this is executed. And in this code status conversation guide, I make sure that we ask about patients' values and goals so that that's formulated into the medical decision making and recommendations that we make for these patients. And exact steps of how to do this is articulated in an article. The first is to establish crisis, that there's an urgent decision making that needs to take place at this time, and ask patients and families about what they already know about their illness or their prognosis, and break the bad news about the acute health decompensation in a clear manner as possible. Then I recommend people to articulate their commitment to helping decide the best care possible for the patient. Then I ask the clinicians about to ask the patients about their values and goals, as well as the patient's baseline quality of life and function. These will help me decide what kind of treatment might be right for the patient. And then I summarize what I heard about the patient's values and goals to the patient or the caregivers, then make a final clinical recommendation about what kind of care is right for the patients. This is articulated in my article, and I hope you can take a look at it. What I find is that most emergency physicians don't exactly know how to incorporate patients' values and goals into their clinical decision making. So that is well explained in the article, and the common pitfalls that I see are folks who would explain about how scary these procedures that patients are facing, or people who are asking patients and families to make choice between treatment A or B, or articulating sort of like the probability of survival in numbers. These are common pitfalls that we hope that you can avoid, and this article explains exactly how to do that. Well, thank you so much for listening to me, and this is my contact information. I would love to hear from you.